Hello everyone, this is Paul from Ortho Eval Pal. Today we're going to be talking about nerve gliding activities. Why do we do nerve glides? Because when a nerve becomes entrapped amongst soft tissue, like after an accident or after an injury or after surgery, your arm is in a sling maybe for a long time, you're not stretching that arm way out here, and therefore the nerves kind of get stuck amongst muscles, fat, and other soft tissues in your arm and can cause problems like tingling or even a sharp pain down your arm. So it's important that you keep those moving. Now, one of the things you need to remember before doing a nerve glide activity is that you don't push yourself too hard. People think that the harder they push it, the better it is. It's not the case with nerve gliding. Okay? So when we do ulnar nerve gliding, what you do is you position yourself like this. You look at the back of your hand while your arm is at a 90-degree angle, elbows at a 90-degree angle. You look at the back of your hand. You depress the shoulder like you're trying to kind of bring the shoulder down toward the floor. And then what you do is you bring the hand back and you try to tilt your head toward that hand. You come out to here, look up, bring the head toward and the hand toward your head. Back and forth like this, gliding that ulnar nerve. You do that 5 times, shake it out, and then you do it again. And I usually do 3 sets of 5 repetitions, okay? Once you have done that, you may notice a little less discomfort down in this area, like the funny bone area. You may even get a little less tingling into the 4th and 5th fingers. That can help the mobility of that nerve in that area. So I hope you liked today's video, and if you did, please give us a thumbs up. Make sure you subscribe, and that really helps with the algorithm of how YouTube sees us out there, and it allows us to bring better content to you so that you can help yourselves and help your patients better. Thanks for watching.